If you're doing the most common stretches for low back pain, then it might feel good, but you're likely causing more damage and prolonging your pain. In this video, I'm going to tell you why that is and outline what you've got to do for both short and long-term relief. Hey, what's up? It's Coach E from Precision Movement, and today we're going to talk about low back pain and specifically why stretching might feel good, but why it's a bad idea, especially when you're dealing with acute low back pain. Okay, so before we get into that, low back pain is a pretty personal topic for me because I started suffering from low back pain when I was a teenager and I had back surgery, and that's where I got this gnarly scar from. And I've had to work through all manners of imbalances, compensations, tightnesses, weaknesses, you name it, I've had to deal with it. And it's this personal experience, as well as the insights that I've gotten coaching hundreds and thousands of people in person and through my courses and through my websites, that has given me a unique insight into what it takes to get rid of low back pain in the short term and to be free from low back pain for good. Okay. Nowadays, I'm able to go to the gym, do whatever I want, play any sport I want, hockey, MMA, rock climbing, surfing, you name it. And I don't have that uncertainty in the back of my mind that I might do something to throw out my low back. Okay. And that's probably the worst part about low back pain is the uncertainty. You're not sure why it happens. It could be something really innocent. And then you don't know how long you're going to be out for. It's going to stop you from doing a lot of things. So low back pain, it's a battle. Okay, so to start off, we're going to talk about why stretching feels good. So there's something called the gait control theory of pain. Now, when you hurt yourself, if you just kind of sit there and focus on it, it's going to hurt a lot. Okay, but oftentimes if you have to do something else or you somehow take your mind off it, the pain diminishes quite a bit. It's kind of like when a little kid hurts themselves and everybody runs to them and fusses over them, then that pain is it's the worst pain in the world, okay? So the gait control theory of pain, it's basically when there's some kind of pain signal going to the body, so in this case, from the low back to the brain, that pain signal is being transmitted to the body for some reason, and we're gonna talk about that in a second. But if there's no other signals going to the brain, then the gate that's between the brain and wherever this pain is open. So the pain signal can go right up to the brain and you feel that it hurts. However, if there's other inputs coming into the brain, for example, stretching, you're doing some stretching, the muscles, the ligaments, the tissues are being stretched, elongated, then that signal is coming into the brain, that can block the pain signal so that it can't get to the brain. So you get some temporary relief. And that occurs for any type of sensory experience. So it could be stretching, could be from exercise, could be from somebody massaging. That's why massages are often something that people turn to when they hurt their low back, and they'll feel good right after they get off the table, but then the next day it comes back. Okay, the same theory. It's the gait control theory of pain. So stretching helps to alleviate the pain in the short term. You'll feel good, you'll feel a little looser, maybe like you can walk around a bit. However, the problem with stretching, especially in an acute situation, is that it might be causing more damage to the tissues that are already damaged. That's causing your pain in the first place. Okay, so let me grab my spine here. And let's use the example of you do something innocent, like bend over to tie your shoelaces, and that's how you threw your back out. Okay, so you bend over, and that movement is flexion. Okay, so you flex the spine, then you feel something, oh, that hurts. And you feel something back here, and you might even have trouble straightening up. Okay, you're all stiff, you're walking like this to the couch. Okay, what happened there is some kind of tissue was damaged from this movement of flexion. Now, it wasn't just that one movement was a damaging movement, but it's because these movements happen repeatedly over time. Now, if you're doing a deadlift with 1,000 pounds and you pull your back out doing that, that could be just that one movement that caused that. But if it's just something simple like bending over to pick up a tissue, then it's the repeated motion over time, and finally, it's the straw that broke the donkey's back. It's just finally hit that point and something broke. Now, in the case of the low back, often it's the discs, intervertebral discs, where the damage might have occurred, or the ligaments. It's typically not the muscles. That's very, very uncommon for the muscles to be strained in something simple and innocent like bending over to tie your shoes. Okay, so the discs or the ligaments have been damaged. Now, here's what's up. Here's why stretching is bad. You start stretching, you do these typical stretches where you bend over. What is the motion of the spine? Okay, what's that look like? It's the same exact motion that happened that caused the damage and the back pain in the first place. Okay, so if we want to get out of pain, does it make sense to recreate the mechanism of injury, to do the same movement that caused the injury? No, logically it does not make sense. If you injure your finger hammering it, are you going to keep hammering it? No, you're not. If it hurts, you're not going to do that anymore. Okay? So, recreating the mechanism of injury, you never want to do that if you're in an acute stage of injury. That's silly. Okay, you're just going to cause more damage to those tissues. So, you do those stretches, you're touching your toes, okay? You're stretching like that, you're twisting your spine, which is even worse, causing more damage or more forces to go through those tissues, the ligaments and the discs, okay? That's why stretching in the acute phase of low back pain is a bad idea, because you're essentially recreating the mechanism of injury, and you're going to cause more tissue damage over time. Okay, so because of the gate control theory of pain, it might feel good in the moment, but because you're causing more damage to the tissues, long term, you're just going to prolong your pain and further weaken those tissues. Okay, so that's why stretching when you're suffering from acute low back pain is a bad idea. Massage could help temporarily, but it's not addressing the root cause of the problem. Okay, the root cause of the problem is injury, is you have an injured tissue due to repetitive movements, whatever those movements are. If it's twisting, if it's flexing, if it's extending, if it's your habitual posture when you're sitting at a desk, whatever the movement or postures are contributing to the damaged tissue, the first stage, during the acute phase, especially those first few weeks or few days where the pain is at its highest, you've got to completely eliminate those movements. There are two main stages when it comes to recovering from low back pain and training yourself for freedom from low back pain. The first stage is the healing stage, and for most people, that's going to last anywhere from 1 to 3 or 4 months. But if you've had low back pain that's very, very severe, it might be even longer, up to a year. You'll be in the healing stage. And during this stage, the focus is on stabilization, so training the stabilizers of the core, as well as maintaining neutral spine through not only the exercises that you do, but through your movements of everyday life. Okay. The second stage, which I call the performance and longevity stage, is different. There, in this stage, it's no longer neutral spine and core stability, but it's dynamic stability and actually training the passive stabilizers and tissues to be stronger so that they're resilient to whatever little movements that you're doing that typically in the past would have resulted in low back pain. So, do you understand the anatomy, the biomechanics, and the physiology behind why stretching feels good, but why it's something that you want to avoid during an acute stage of low back pain? Hopefully, explain that as best as I could. It's been a life changer for me and for many of my clients, and I hope it's going to be a life changer for you too.